Very urgent signs. These include a tiny baby younger than 2 months, inconsolable crying or severe pain, presenting complaint more sleepy than normal, poisoning or overdose, focal neurology acute, severe mechanism of injury, burns, circumferential, electrical, chemical, 10% or more, fracture, open or threatened limb, dislocation of larger joint, not finger or toe. If any of these very urgent signs are identified, we proceed to calculating the TEWS and checking for additional investigations. Tiny baby, younger than 2 months. Small babies are more difficult to assess properly. They are more prone to getting infections from other patients, and they are more likely to deteriorate quickly if they are unwell. All tiny babies of under 2 months of age should therefore be seen very urgently. Do not forget to measure and document the vital signs, calculate the TEWS, and check for additional investigations. Inconsolable crying or severe pain. The inconsolable crying child is conscious but cries constantly and will not settle. Likewise, if a child has severe pain and is in agony, she or he should be prioritized to receive very urgent assessment and pain relief. Severe pain may be due to severe conditions such as acute abdomen, meningitis. Generally, the caregiver will volunteer this information when describing the presenting complaint. Again, do not forget to measure the vital signs, calculate the TEWS, and check for additional investigations. Presenting complaint more sleepy than normal. When the mother complains that her child is more sleepy than normal, the child may be in the early stages of serious conditions such as meningitis, hypoglycemia, septicemia, non-accidental injuries, and drug ingestion, and will need to be identified and managed very urgently. Measure vitals, calculate the TEWS, and in this case, an additional investigation needs to be initiated, and that is the glucose needs to be checked. If it is less than 3, the child needs to be taken straight to the resuscitation area. Poisoning or overdose. A child with a history of swallowing drugs or other dangerous substances needs to be assessed very urgently, as she or he can deteriorate rapidly and might need specific treatment depending on the substance taken. The mother will tell you if she has brought the child because of possible intoxication. After having measured the vitals, calculated the TEWS, and checked for additional investigations, you should consult the senior healthcare professional for advice regarding very urgent management. Focal neurology acute. A child who is fully conscious but has new focal neurological signs will need very urgent assessment. In this case, the child does not require emergency treatment because they do not have any ABCD emergency signs, but they may need urgent imaging and intervention. Examples of focal neurological signs include cranial nerve palsies and acutely paralyzed limbs. Their presence may indicate a form of vascular stroke, and management may be time-dependent. Ways of picking up a focal neurology acute would be to have a look and observe the face. A new onset of a squint or a facial weakness that was not present before would be an indication of this, as well as a limb that is not moving as normal. Severe mechanism of injury. Usually this is an obvious case, but one needs to think of motor vehicle accidents, pedestrian vehicle accidents, motorbike accidents, falls from a height greater than 1 meter, gunshot wounds, and other traumatic mechanisms of injury in this category. The ABC-CCDO assessment will clear any life-threatening problems requiring immediate care. Burns. These include circumferential burn, electrical burn, chemical burn, and any burn involving 10% or more of the body surface area. Burns are extremely painful, and children who seem quite well can deteriorate rapidly. The size of the burn needs to be determined using the rule of 9's method. The Palmer method is more suitable for smaller burns. For any child with a major burn, resuscitation must be commenced.
After having measured the vitals, calculated the TEWS, and checked for additional investigations,
follow the provincial burns management guidelines, including analgesia.
Eye injury. This is fairly self-explanatory, but if uncertainty arises, seek advice from the senior healthcare professional. Do not forget to measure the vitals, calculate the TEWS, and check for additional investigations.
Fracture open or threatened limb. An open fracture may be associated with a large volume of blood loss that may be very obvious external or may be concealed internal, perhaps only recognizable by swelling around the fracture area. This needs very urgent attention. Dislocation of a large joint, not a finger or toe. Apart from being very painful, a large joint dislocation may compromise blood and nerve supply to the limb distal to the affected joint. Damage to the neurovascular bundle implies serious injury and needs very urgent attention. In summary, after identifying a very urgent clinical sign, commence to calculating the TEWS and checking for additional investigations. Your triage process is only complete once you have personally handed the patient over for further appropriate management.